Good evening to you, my viewers. This is Bernd Christian Giels coming to you on the very last day of August in the year 2020. I'm so pleased that you've come back to join me for another episode. I thank all of my loyal viewers, and I hope in the coming months to build a truly substantial and loyal viewership here for my channel. So I've gone through a number of changes in the last several weeks, and that is partially why I have not been recording as much content recently. I've had a lot of other priorities to attend to most recently. One of my biggest pieces of news is that I have, as of very recently, relocated from Cape Cod, and I am now in the process of securing more appropriate housing for myself within the vicinity of the Boston metro area. One of the primary reasons that I left Cape Cod is actually very much interconnected to the topic of this episode, which is the American healthcare system. So I left Cape Cod due in large measure to the fact that I could not find adequate health care to meet my particular needs on Cape Cod. In this particular episode, I'm not going to go into great detail about what those particular needs are that I have. In a subsequent episode, however, I will be focusing exclusively on the Americans with Disabilities Act, the ADA, which celebrated its 30-year anniversary earlier this year. And in that episode, I will speak about the history of the ADA and the issues and challenges that Americans living with disabilities face in the current era in 2020, and hopefully also spend some time talking about our prospects in the upcoming years. So, the American healthcare system is being strained mightily this year, in large measure due to, as I'm sure you can guess, the COVID-19 or coronavirus pandemic. And according to the latest data that I have seen, more than 6 million Americans have now been infected with the novel coronavirus, and approximately 184,000 Americans have now died. One of the most recent projections of the IMHE, the Institute for Health Metrics and Evaluation, based in the state of Washington, now predicts that by December 1st, we will have well in excess of 300,000 deaths attributable to the pandemic during its entire history thus far. And that is an increase over the past projection, the most recent weekly iteration of the projection before the current one, and that prediction was an increase over the prior prediction the week before that. Now, obviously, a number of factors are going to continue to influence how the pandemic spreads, how many people get infected, where the hot spots develop, and where we successfully limit transmission of the virus. For those of you who have not seen other episodes, I have, since the beginning of July, been writing a weekly article focused on the status of the coronavirus pandemic in the American Sunbelt. If you are interested to learn more about that weekly article, I welcome you to message me, and I will be happy to share that content with you. So, as I said, the American healthcare system is under immense strain in the current moment. We have faced a significant threat to our public health. We have faced this challenge, sadly, with insufficient quantities of PPE, personal protective equipment. And even now, months after the pandemic first came to our shores and exploded in earnest in March of this year, we still face some of these same fundamental issues of availability of necessary medical equipment, even things as simple as personal protective equipment, such as gloves and gowns and face masks. Now, what I'm going to focus on specifically in this episode in relation to the American healthcare system is the design of it that is fundamentally causing us immense problems at this very moment. And what I'm alluding to here is the reality that millions of Americans depend on their employment as the source not only of their income, but also as the source of their health insurance. Now, before I go on, I want to point out one unrelated thing. If you're hearing music in the background at a very gentle volume, you are in fact hearing music. I have a very relaxing soundtrack playing in the background as a way of mellowing out after a fairly demanding day. So take it as my offering to you of something soothing to listen to in the background while I talk about this challenging issue. So, millions of Americans rely upon their employers as the primary source of their health care insurance, if not the only source of it. Now, obviously, why would there be a problem if we designed it that way? Well, if you have a massive economic crisis, as we are suffering now due to the pandemic, and millions of Americans lose their jobs, you're left with another devastation beyond the loss of income. These Americans are now also facing the prospect of terminated health insurance at a time when going without health insurance could be incredibly risky, if not deadly. Now, for anyone who has followed the American healthcare system over the years and decades, issues of availability and affordability of healthcare insurance have been a mainstay problem of the system for years. It's quite easy to find horror stories online of people who, due to the fact that they were underinsured or uninsured, were not able to afford costly procedures, medication, therapy, and other types of treatment interventions that were necessary, medically necessary, to sustain them or even just to prevent them from dying. And so now, in the year 2020, we find millions more Americans facing the prospect of destitution, unpayable medical bills, depression, anxiety, and despair as they have gone through a horrific ordeal of losing their jobs and their health insurance in all too many cases. Now, if you're wondering exactly how many people have lost their jobs, I refer you to some of the articles that I have read through as source material for this episode. And links to those articles can be found in the information box regarding the contents of this episode. So, one particular piece that I enjoyed reading, it was an opinion piece written by Janine Interlandi, who is a member of the editorial board for the New York Times. This is an opinion piece she wrote on June 29th of this year, so only about 2 months old. And in that piece, she talked about how, among other things, if the American healthcare system were its own country, its gross domestic product would make it the 4th largest country in the world by that measure. So we have a system that is extraordinarily financially intensive. It's expensive. And yet at the same time, despite the expensive nature of our system, the outcomes that Americans can expect within our system are not commensurate with the costs that they incur. And so one is left to wonder, well, why is that? Why do we pay so much and get so little? Now, her opinion piece notes that at the beginning of this year, there were about 160 million Americans receiving health benefits through an employer. She further notes that the vast majority of these Americans receiving insurance through their employers were, at the very least, satisfied with their health insurance. Now, for those of you not aware of the size of the United States populace, our country has approximately 330 million Americans. So 160 million Americans is basically 50% of the population. So it is not a small percentage of the population who had health benefits through their employer at the beginning of 2020. But alas, what happened this year was a cataclysm, a catastrophe of multiple crises, all intricately interconnected to one another and mutually reinforcing. So the COVID-19 pandemic began. States responded with a variety of measures to reduce the spread, including lockdowns. Employers furloughed their employees, or they went on other forms of leave, or they were made to adjust to reduced hours in their employment. Now, for the millions of Americans who lost their jobs entirely and had health insurance tied to their jobs, then they faced a new crisis, not just of loss of income, but loss of health insurance. So, as she notes in this article, as the pandemic began and the economic collapse began thereafter, more than 40 million Americans filed new unemployment claims in the very narrow window of time between mid-March and late May of this year. So in about 10 to 11 weeks, 40 million Americans filed claims for unemployment benefits. It wasn't a uniform spread of about 4 million Americans per week. The spike in benefit claims being filed occurred around the beginning of April, when nearly 6 to 7 million Americans filed claims for benefits. Since that time, the weekly filing rate for unemployment benefits has declined, but sadly, even as we end the month of August, the rate of new weekly claims, remains persistently high, near roughly 1 million Americans per week. That is astounding when you compare those metrics, those values, against the Great Recession of approximately 10 years ago, as well as against even the Great Depression of some 90 years ago. Ms. Interlandi notes in her opinion piece that of those who lost their jobs, 41% of those 41% of those who lost a job had relied on health insurance that they had from that job. So what we find is that millions of Americans have lost their jobs, and a large portion of those who lost their jobs relied upon their jobs as a primary source of their health insurance, if not the sole source of their health insurance. And so now we are left scratching our heads months later, wondering how to find our way out of this catastrophe in which the health and wealth and future prosperity of our nation is at serious risk due to a pandemic that, had it been better responded to earlier this year, might have led to a loss of life much less than the current death toll. Now, one of the serious problems with the system, besides the fact of this strong connection between employment and health insurance access, is the patchwork nature of the healthcare insurance system in this country. As is true of so many other things about American society and American life, what your experience is, what your opportunities are, where you go to find a job, what kind of job you have, and what kind of future career aspirations you may reasonably expect to attain are all, sadly, often quite contingent upon what state you are living in. And so in some of the wealthier states of this country, and in some of the wealthiest cities of this country, where you have high-earning professionals with advanced degrees, these individuals are in the great scheme of things, at relatively low risk of suffering a catastrophic loss that then cascades through their entire life and renders them deeply vulnerable to major problems such as homelessness, illness, bankruptcy, and utter destitution. But obviously, America is much more than our big cities. America is a much larger place than New York City and Chicago and Seattle and Los Angeles and San Francisco and Miami and Atlanta. There are countless other cities with robust populations for their sizes that have also suffered through this pandemic. Cities that have had to change up their methodology for how they are going to go about educating the young people in their populace. And so providing health care to 330 million Americans is, if anything, not a unified endeavor. The system is indeed a patchwork of policies and providers and availability and quality of care that varies dramatically from state to state and region to region. If you'll give me a moment here, I'm just going to toggle over to my other main source article. So, another one of the problems, besides the link between employment and insurance in the patchwork system within our country, is the available options for people who do end up becoming employed. So, one of the resources available to people who become unemployed is COBRA. Now, COBRA is an option in which workers can extend their employer-based health insurance for a period of up to 36 months. But the very large downside to this is that going on to COBRA is incredibly expensive for many people because employees, former employees, take on the full cost of premiums without contributions from their former employers. And so basically, the responsibility for maintaining health insurance, the financial cost, is shoved pretty much exclusively onto these now unemployed individuals. And according to a Huffington Post article that I read that was published this year in August, actually just a month ago, the cost for COBRA is nearly $20,000. It says the average annual cost of a job-based family health insurance plan is nearly $20,000, which translates to more than $1,600 a month. So, basically, the options available for even those who were working and doing well by themselves, if they should become unemployed, and especially if they should become long-term unemployed and have minimal financial resources in place, are not great. Now, this Huffington Post article that I am referring to that was written just a month ago also speaks about Medicaid. So Medicaid is a safety net program that currently covers more than 70 million people. But sadly, access to Medicaid is limited, and as is true of so many other parts of our healthcare system, varies greatly from state to state, especially for adults. Now, on the subject of the patchwork nature of the American healthcare system, there was, during the Obama administration, an effort to expand Medicaid in states. However, in these most recent years, both during the Obama administration and during the current administration of President Trump, a number of states have refused to adopt the Medicaid expansion. And in these states that have not expanded Medicaid, adults who don't have children living at home and don't have disabilities, they cannot access coverage regardless of how low their incomes are. So think about that. You could have not a dime to your name and have no income and still find yourself living in portions of this country, a nation that has prided itself on its exceptional status in the world. There are people that can find themselves in this country in the most impoverished and destitute of circumstances, and they cannot find sufficient health care access and coverage through insurance to minimize the risk of them seriously suffering to a level of risk that can easily be managed and lived with, to where you can sleep at night and not worry about what might happen to you or your children if something catastrophic happens to you. This is the status of our American healthcare system in the year 2020. So, there you have it. That is, in a nutshell, but no means by any means an exhaustive description of some of the major issues with the American healthcare system in our present era. Just reviewing them, they are: one, much of the insurance market is tied to people having gainful employment. Two, the patchwork nature of healthcare policies, care, and quality hospitals throughout this country. That's the second major issue, is the patchwork nature of the system. And then third, the fact that even the resources that are available as safety nets to people in this country who are facing serious risk of destitution, homelessness, domestic violence, any number of very serious problems in their lives, the resources in place to help the most at risk among us are cost prohibitive to many of these people. Many of these people. And so what I ask you, my viewers who are watching this and pondering our system, is how would you design an effective, equitable, accessible, cost-appropriate healthcare system for a multicultural, diverse nation of 330 million individuals of various cultural, socioeconomic, age, gender, sexual orientation, gender identity backgrounds? And I apologize if I've left out some of the many categories of how we differentiate each other. But I think you get my point. What would be the way that we could create a system that would be accessible, equitable, cost appropriate, comprehensive, and effective? If we were to design the most amazing healthcare system in the world, what would that look like? And I'm going to finally close this video by talking about a portion of my life history. And this is going to segue into my forthcoming episode about the Americans with Disabilities Act, its history, and the status of it in the year 2020. So, I am an American who has a history of a disability. I am an American who grew up in a state with very minimal legislative framework and policy surrounding the sale, transfer, use, training, and disposal of firearms and weaponry. I am an American who grew up at a time when much was still not understood about certain illnesses such as schizophrenia. My birth mother, my biological mother, developed schizophrenia when she was a very young woman. And though that occurred over 40 years ago now, there is a part of my heart that to this day carries the pain of the loss of her abiding presence in my life. For those of us like myself who are the adult children of parents who developed and or still suffer from mental illness, I say, I know what it feels like. It's a rough road. And it's a rough road for so many of us because, like I said about my own personal journey, the medical community, the mental health care system, both in the United States of America and in much of the developed world, had very little substantial, authoritative knowledge about phenomena, illnesses, it's another word I'll use that's correct, illnesses such as schizophrenia. And so we, the children who were born in the 50s and 60s and 70s, and I would say even the 80s, grew up at a time when the medical understanding of certain serious psychiatric conditions was quite lacking, was not sufficient to provide a level of comfort and support that not only the members of our families needed who became dreadfully sick, but also those of us who witnessed their illnesses take over their lives and undermine so much of who they once were. So, I am an American who did not receive truly effective and thorough care for my own health needs until far into my adulthood. Due to what I witnessed happen to my mother when I was a small boy, and due to subsequent issues in my home, including domestic violence, I experienced substantial trauma and fear. And that trauma and fear left an imprint upon my psyche, upon my sense of self, that required me to eventually go through some significant treatment to become a more fully realized human being. And sadly, access to that type of care, mental health care, in this country also varies significantly from state to state. And so a person born into the United States of America as an American citizen in the state of Mississippi or Alabama or Florida will quite likely experience some different outcomes in how their life develops as compared to someone born into a middle or upper class family in a wealthy city in a more progressive state. And that, I think, is one of the greatest tragedies of our country, is that we have this amazing idea that we are all created equal, that we are all endowed by our Creator with certain inalienable rights. We have this amazing idea that this country is a place for life, for liberty, for the pursuit of happiness. But our ability to pursue that happiness that we so deeply desire, that ability is so often, sadly, contingent upon the circumstances of our early lives. People who have what are called adverse childhood experiences, or ACEs, often go on to live lives that are more frequently marked by serious challenges and pain, such as unstable employment, difficult, dysfunctional, or even abusive relationships. People who suffer from adverse experiences earlier in their lives, from what I understand, are more likely to not achieve the same quality or standard of life as their peers who have not gone through such adverse experiences. So basically, if you take the lives of two people and plot the trajectory of those lives over time, you are more likely to see individuals with multiple adverse childhood experiences take a course in their life that is poorer, sicker, and shorter, and more unhappy than people who do not endure one or a multitude of adverse childhood experiences. And so, what is the solution then? Is there a solution to this part of the American healthcare system puzzle? Yes. The solution, if we're going to be serious about this, is early intervention and monitoring and care of the youngest among us in this country. If we really care about our children and their future, if we really care about the quality of their life, if we really care about their professional prospects, if we really care about the potential they have to create their own wealth, to enjoy a good quality of life marked by an abundance of the basic needs we all have that we must fulfill every day, such as food and clothing and water and shelter, if we're really serious about creating a generation of people in this country that truly realize the dream of America, the greatest and brightest dream of this country, then we have to be serious about how we treat children, not just before they're born, and not just ensuring that they are brought into this world in a healthy way, but about what happens to them from that very moment that they are born. And until we address a multitude of challenges in this country, I remain firmly convinced that we will continue to face radically different outcomes in the lives of our fellow Americans, to the point that we will be living in an America that is unrecognizable to some of our fellow Americans. One of the saddest things that I think is happening now, most likely, and may continue to happen, is the hollowing out of the middle class and the risk that more and more people live within this country of falling into utter destitution through no fault of their own. Through no fault of their own. And so, what concerns me is people who are in the middle class or the lower middle class who have suffered through a series of setbacks and have fought hard to amass whatever they have in their lives, and now are facing the year 2020 with a pandemic and high levels of unemployment and job loss, and the very real prospect of losing some of their extended family to the coronavirus, and the consequences to their social lives, to the social lives of all of us, to where now it has become the norm to engage in most of our social activities remotely, using computers that not all Americans have easy access to, if any access at all. One of the sad things that I experienced while I was still living on Cape Cod that confused me, especially given the relative wealth that Barnstable County has and has the reputation of having, is how little the services provided by the library system has come back since the pandemic first precipitated the lockdowns and other measures, not just here in the state of Massachusetts, but throughout this country. Libraries are one of our greatest institutions in this country, I would argue. Why? Because they serve a multitude of purposes. They are probably one of the best investments of a dollar put in. If you were to do an economic analysis of the impact, the value to a local community from the provision of $1 to this institution or that institution, you would probably find that libraries are one of the best returns on an investment. They provide a place for people who are students to pursue their educations. They provide a quiet place for people who perhaps have lives where quiet is not exactly something they have easy access to. They also are temperature controlled environments. So think about people who don't have air conditioning at home, or in the darkest and coldest days of winter have poor heating in their homes. And so they venture out to a public place like a library simply for the comfort of the space. Libraries are great places for little children, with reading programs and art and children's books and beautiful spaces to inspire their curiosity. Libraries have a profound impact on the lives of our future adult Americans. Libraries are a place that children associate with fun. Not all children, obviously, but if we educate and love and support the children of America in a proactive, substantial way, we will see, I am convinced, a massive return on that investment. And so, with those comments, I'm going to close this episode. As you can sense, I have strong opinions about our American healthcare system. I will go into greater detail about my own life experience in an upcoming episode in which I will also speak about the ADA, the Americans with Disabilities Act, which was passed in the year 1990 by former President George Herbert Walker Bush. So until my next episode, I thank you all for having watched. As I've said before in previous episodes, please tell your friends, your family, your colleagues, and even your pets about me. There are some talented cats and dogs out there that would love to watch a cute video or an informative video. And I certainly watch a lot of cute cat videos, so why can't cats watch a few of my videos, right? So, thank you for watching. Thank you for caring. Thank you for learning. Thank you for reading. Thank you for checking up on your neighbor. Thank you for bringing food to strangers. Thank you to all of my viewers who, in large and small ways, care about the fabric of this nation and about its future. I, for one, salute you. I know what it's like to do the hard work of certain jobs. I know how grinding life can be in this nation. I salute all of you of all backgrounds for being good American people. May you be blessed. I look forward to talking again soon. Cheers.